Millions of people in the United States are affected by peripheral artery disease, or PAD. It's a dangerous disease that not only causes pain in the legs and feet, but is also associated with an increased rate of cardiovascular events and death. So, what should you do if you've been diagnosed with PAD? Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. PAD is a narrowing of the peripheral arteries, or arteries that carry blood away from the heart to other parts of the body, such as the arms and legs. This narrowing of the arteries is called atherosclerosis, and it happens when fatty deposits build up in the arteries. When those fatty deposits, also known as plaque, build up, it narrows the arteries, which decreases blood flow throughout the body. In the case of PAD, these fatty deposits build up in the arteries outside the heart that pump oxygen-rich blood to the arms, legs, and feet. And while PAD is most common in the legs and feet, about 10% of the population experiences it in the arms, hands, and fingers. By reducing blood flow to the legs and feet, PAD can make walking increasingly difficult. This reduced blood flow can result in a condition known as claudication, which is pain, cramping, or discomfort in the muscles, typically in the calves, thighs, or buttocks during physical activity such as walking or climbing stairs. While there are a number of ways to prevent and treat PAD, one effective treatment for PAD symptoms is regular physical activity. Your doctor may recommend supervised exercise training, also known as supervised exercise therapy, or SET. This usually involves walking on a treadmill under the supervision of a physical therapist. In a typical SET protocol, patients walk on a treadmill set to 2 miles per hour with a grade of 0, meaning the walking surface is completely flat. Then every 2 minutes, the incline of the treadmill would increase 2%. The total walking time depends on when you begin to feel symptoms, but typically you would walk for 30 minutes and do this 3 times a week for about 6 months. The goal of a walking program like this is to be able to walk pain-free and for longer distances. Studies have found other benefits as well, including improved balance. One major advantage of this kind of therapy is that it's done in a standardized setting where the speed and grade of the treadmill can be controlled and your walking can be observed. But sometimes this kind of supervised therapy isn't covered by your insurance, or maybe you can't get to a rehab center 3 times a week. What then? Well, there's good news. There are effective exercise programs you can do at home that can address your PAD symptoms. I'm going to walk you through the 6 simple steps of a walking regimen that you can do at home. Step 1, warm up. It's important to get your body ready for exercise. For walking, you can warm up by stretching your calf and thigh muscles in each leg for about 10 to 15 seconds. Step 2, start walking. Walk at a moderately fast pace for about 5 minutes, even though it may cause some pain. Research has shown that exercise that leads to leg pain can improve leg function, even though it may be difficult. Step 3, stop and rest. After 5 minutes of mild or moderate pain, stop and rest until the pain goes away. Step 4, repeat the walk and stop routine several times. During the first 2 months of your walking program, build up slowly to walking a total of 35 minutes each session, not counting the rest breaks. Keep adding a few minutes until you're at the goal of walking 50 minutes total. Step 5, cool down. Finish by walking slowly for 5 minutes, then stretch your calf and thigh muscles again. Step 6, stick with it. Your goal should be to eventually do 50 minutes of walking at least 3 to 5 times a week. As that becomes easier, challenge yourself to work harder. You could try walking up hills or stairs, or if you're walking on a treadmill, add an incline to your treadmill routine. While you may have to begin an exercise program like this slowly, simple walking regimens like this one can help increase leg strength, making it easier to walk and climb stairs and ease your PAD symptoms. As a bonus, 50 minutes of walking 3 to 5 times a week is great for your overall heart health, not to mention your mental health. And if you can encourage a friend or family member to join you, you can make it even more enjoyable and help someone else take care of their heart too. Though PAD is a lifelong medical condition, people with PAD can still lead long and active lives. So if you notice that walking or climbing stairs is becoming painful or more difficult, talk with your doctor and be sure to describe what you're experiencing as accurately as you can. Let's recap some key takeaways. PAD is a narrowing of the arteries that carry blood away from the heart to other parts of the body like the arms and legs. PAD causes cramping or leg pain while walking or climbing stairs. Physical activity is an effective treatment for PAD symptoms. A walking regimen can increase leg strength, make it easier to walk and climb stairs, and ease your PAD symptoms. If you're having trouble with your feet or legs, ask your doctor about PAD. And if you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, and join me here next time for Answers You Can Trust.